Mirataz was first approved by the FDA on the 4th of May 2018 and subsequently launched to the American market the following July. This means that our colleagues in the US have been using Mirataz to address unintended feline weight loss for approximately 3 years now at the time of recording this Q&A. European approval was gained in December 2019, and then DECRA acquired the worldwide rights to Mirataz in April 2020. The European launch of the product was February 2021. To answer the question, should gloves be worn when applying Mirataz? The answer is absolutely yes. So the Mirataz SPC does state that impermeable disposable protective gloves should be provided at the point of sale of Mirataz and should be worn when handling and administering the veterinary medicinal product. There is an image on the outer packaging depicting gloves before the tube is accessed, and within the SPC and the package leaflet there is this pictogram which depicts applying Mirataz, of which stage 1 is popping on gloves. The licensed administration schedule for Mirataz is to apply it once daily for 14 days, and therefore we do not recommend stopping therapy before this time period has ended. It should be remembered that Mirataz is licensed for longer term body weight gain. In order to achieve this goal of increased body weight in our feline patients, it is therefore recommended to complete the full 14-day treatment course. With regards to repeating 14-day courses, the pivotal field trial that led to authorisation of Mirataz lasted for only one treatment course or 14 days. That was because, due to the rapid action of Mirataz, we were able to demonstrate a statistically significant increase in body weight in that short time period. Therefore, repetition of treatment has not been investigated and as such should only be undertaken after a risk versus benefit analysis by yourselves as the attending vet. During the webinar, we received a number of questions with regards to the precautions which must be taken for the person administering Mirataz, or what the implications were for treatment with Mirataz for the owner. Examples of these questions are shown here. The Mirataz SPC states to avoid contact with the treated animal for the first 12 hours after each daily administration and until the application site is dry. I wanted to take some time during this Q&A to explain to you the reasons behind the 12-hour time period and how it is derived. For registration of any topical product, a user safety assessment must be undertaken, and as part of this, a margin of exposure must be calculated. The MOE is the acceptable amount of exposure to a person who contacts the treated animal and takes into account many factors. These include NOEL, the no observable effect level, which usually comes from laboratory data. The next is amount of residue at time points following application, so this is more commonly known as a wipe test. There's the dose given to the cat, and although the licensed dose is approximately 2 milligrams, it is taken into account that this may vary dependent on application from 1 to 4 milligrams. Both the size of the animal and the size of person exposed are taken into account. And finally, so is the route of exposure. So was this via skin or via the oral route? product registration, the worst case scenario of these factors are used. Specifically for Mirataz, this included the smallest weight of human being exposed, so this is modelled as a 12.5 kilogram toddler, exposure via both the transdermal and the oral routes, to the largest volume of product, so 4 milligrams, in the smallest cat size. In order to best avoid contact for the 12-hour period, it is recommended that Mirataz is applied in the evening before the owner goes to bed. When treated in this way, it is important that the cat does not sleep with the owner throughout the treatment period, and this is especially the case for children and pregnant women. However, communication is key when it comes to this. It may be the case that the owner is out for work during the day and is used to leaving the cat for this period but spending more time with their feline friend in the evening. In this scenario, it therefore may be best to apply Mirataz in the morning, so the avoidance period is during that time at work. In any case, the topic is worth discussing with your owners to find a routine that fits for them. As documented in the Mirataz SPC, the adverse reactions which were most commonly recorded during safety and efficacy studies for Mirataz were application site reactions and behavioural changes. It is important that all adverse reactions are documented, and we would recommend you contacting your local DECRA representative should that occur. More information on adverse reactions can be found within the Mirataz SPC. No special precautions are required in order to try and prevent oral exposure of Mirataz treated cats. Elizabethan collars, as an example, were not a requirement during the pivotal field trial which led to authorisation of Mirataz. It is therefore possible that there was both transdermal and some oral exposure during that trial as part of the cat's normal grooming. However, there were no reports of adverse events associated with apparent oral exposure during the study, and it is unlikely that the treated cat will be able to lick and ingest the entire dose from their ear. So there are 4 main groups of contraindications for Mirataz. The first is that it shouldn't be used in breeding, lactating or pregnant cats. The second is that it shouldn't be used in kittens under 7.5 months old, or if the cat weighs under 2 kilograms in general. It shouldn't be used if there is a known hypersensitivity to either the active substance or any of the excipients. And finally, it shouldn't be used in combination with cyproheptadine, tramadol or monoamine oxidase inhibitors, or within 14 days of the latter, due to the increased risk of serotonin syndrome. Further information on these contraindications can be found in the Mirataz SPC or by contacting your local DECRA sales representative.